What do hormones have to do with sleep apnea? In this video, I'm going to go over 10 specific hormones that are found to either make sleep apnea better or worse. I'm sure that you'll be surprised by what you'll learn. I was surprised by some of this as well. Stick to the end when I reveal one particular hormone that you'll never expect, one that the vast majority of people in the US and the rest of the world is very low in. Hi, I'm Dr. Stephen Park, an ENT surgeon and sleep medicine doctor with a passion for helping you to breathe better and sleep better. Please support my channel by clicking the thumbs up button as well as the subscribe button, and also please share these videos with someone you care about. One of the reasons why obstructive sleep apnea and upper airway resistance syndrome can be so challenging to treat is because there are multiple reasons. This is unlike some other medical conditions, like when there's one particular mineral deficiency or bacterial infection. A hormone, by definition, is a chemical messenger that travels through the bloodstream to tell your body what and when to do a particular function. This is usually done along with the nervous system since nerve signals can travel much faster. And you have to remember that hormones work in all parts of your body, not just in one organ. I got the idea for this video when I was looking into how sleep apnea affects thyroid levels and vice versa. This led to reproductive hormones, stress hormones, and so on. Ultimately, all the hormones are connected. I hope you'll appreciate how complex but intricately our bodies work, and that's why it's important to always look at the big picture when it comes to improving your sleep or your health, and not define ourselves with one particular diagnosis, such as I have hypothyroidism or I have sleep apnea. That one diagnosis is one small part of the dozens or even hundreds of disturbances in your body that prevents optimal health and wellness. So to start with number one, let's talk about thyroid hormones. This hormone is not just about regulating your metabolism, but also controls protein synthesis, promotes long bone growth along with growth hormone, helps the nervous system mature, and raises the body's sensitivity to stress hormones. There's a feedback loop in the brain where thyroid stimulating hormone is made if thyroid hormones in the body are on the low side. If it's too high, thyroid stimulating hormone goes down. It's been shown that patients with sleep apnea tend to have higher levels of thyroid stimulating hormone or TSH, meaning that the body thinks that there isn't enough thyroid hormone. And with CPAP, TSH levels go down with more normal levels of thyroid hormone. And all the studies looking at the rates of sleep apnea in hypothyroid patients and hypothyroidism in sleep apnea are on the low side. So the general consensus is that no screening is needed for one if you have the other. But these numbers range in the low single digits to over 10% in both directions, so you should never rule out one if you have the other. If you think about it, having low thyroid levels will cause you to gain weight, which will raise your chances of having sleep apnea. This is somewhat of a confusing issue, with many conflicting studies using very small sample sizes, and it's difficult to recruit subjects with this kind of study. Regardless, I think this bidirectional association, even if weak, shouldn't be ignored and looked for and treated independently. Number two is growth hormone. I mentioned in a previous video on how to grow healthy and happy children that the main time for growth hormone secretion is during sleep, especially in slow wave deep sleep, especially for boys and men. Not unexpectedly, growth hormone goes up with CPAP or any other sleep apnea treatment. Similar to thyroid hormone, growth hormone has many other functions besides growing muscles and bones, including the release of insulin-like growth factor 1, or IGF-1, which is involved with glucose regulation, and it regulates healthy heart, nervous system, and kidney functioning. Number three is testosterone. There are many studies that show that having sleep apnea correlates with lower levels of testosterone in men. The most recent meta-analysis of 5 studies to see if CPAP can raise testosterone was somewhat inconclusive, but there was a trend towards significance in men who had low total testosterone levels. Here you can see the black diamond, which is the average of all the studies, and it's almost all on the right side of the line, showing increase in testosterone, with only the edge on the left side touching the midline, which denotes no change. Typically, with these type of studies that show a trend towards significance, a higher number of subjects can push this black diamond off the midline completely. However, this one particular study did find that after CPAP in men with sleep apnea, their low levels of testosterone, luteinizing hormone, and follicle stimulating hormone all went up. Although using testosterone to treat these patients can be done, there's some suggestion that it can actually worsen sleep apnea, so it's generally not recommended. One more thing to consider is that low testosterone levels correlate strongly with increasing weight, and losing weight was shown to raise testosterone levels. Number 4. Now let's go to hormones for women, the first of which is progesterone. This is the most important hormone for women with regard to sleep and breathing, since it's a powerful respiratory stimulant. It drives breathing and also raises women's tongue muscle tone. Premenopausal women have the highest levels of progesterone during the luteal phase between ovulation and menses. This explains why sleep quality can go down just before women's periods as progesterone levels drop. I talked about this in my last video about many women who have throat pain just before the periods, mainly due to more relaxed tongue muscles with more apneas and reflux. And during perimenopause and menopause for women, progesterone goes down gradually, but estrogen levels remain for a bit longer. This is why postmenopausal women who get estrogen and progesterone hormone replacement therapy sleep much better in general. If you measure the tongue muscle activity with electrodes, it's as active as levels before menopause. Over 10 years ago, hormone replacement therapy in postmenopausal women was found to significantly raise one's risk of stroke, blood clots, and heart disease. But this study was done using conventional synthetic hormones, which have known side effects. However, there are no significant side effects from being given bioidentical hormones, including estrogen and progesterone. This has been given to women for decades by naturalistic and holistic doctors. And this is also why women start to catch up to men with sleep apnea after menopause, along with heart disease rates as well. It's clear that progesterone has a protective effect on the heart for women until menopause, most likely due to the fact that you can literally breathe better due to having more progesterone. Not too surprisingly, women with sleep apnea are found to have lower levels of the two hormones that come from the brain, luteinizing hormone and follicle stimulating hormone. Since these two hormones go to the ovaries to cycle estrogen and progesterone, having low levels can definitely affect reproductive function in general. I'll do another video on this fascinating subject in a future video. Number 5. Moving on to estrogen. It's not as strong of a respiratory stimulant as progesterone, but it does have some effect. Here are two of the many breathing benefits of estrogen. Estradiol, the main estrogen produced by the ovaries in women of reproductive age, helps to increase the sensitivity of progesterone receptors. During the luteal phase, for 2 weeks after ovulation, both estradiol and progesterone go up, with estradiol enhancing progesterone's effect. On the other hand, if there's relatively too much estrogen around, such as due to making much less progesterone during menopause, or too much fat in the body, which makes estrogen E1, which doesn't enhance progesterone receptors like E2, or too high levels of xenoestrogens, which can come from the household environment, certain foods, and plastics. You have to have the right balance between E2 and progesterone to have optimal breathing and sleep. One important concept that I have to mention is something called estrogen dominance. Because our environment and food supply are flooded with materials that contain toxins that mimic estrogen, this can mess up the delicate balance between all of our body's hormones. Especially in women, having too much estrogen can suppress progesterone, and I hope I've made my point about how important it is for women's sleep and health. These estrogen-mimicking toxins are called xenoestrogens and can be found in a number of different places such as store receipts, water, cleaning products, cookware, personal care products, and the list is endless. I'll place a link to a great resource by Megan Telpner in the description area below. Now, there's a certain protocol called seed cycling, which uses pumpkin seeds and ground flax to help to support healthy hormone cycles. It's usually taken for the first 2 weeks of the menstrual cycle, also called the follicular phase. This is when estrogen and progesterone are at their lowest. During the second half of the cycle, called the luteal phase, sunflower and sesame seeds are used. My wife Kathy has been doing this for a while with good results. I'll place a brief introduction about seed cycling from Dr. Mark Hyman below. Number 6 is Orexin, also known as hypocretin. It's one of the major neurotransmitters that helps you to be alert and stay awake. Lack of this hormone leads to what's called narcolepsy, and it's thought to happen due to an autoimmune process. But is autoimmunity linked with obstructive sleep apnea? This study found that the risk of autoimmunity is almost double if you have sleep apnea. We actually published a review paper on this subject a while back. One thing that even I didn't know about until recently is that orexin stimulates the tongue muscle's airway dilator muscle, the genia glossus. If you look at this graph, notice that it goes up after eating, since it's also involved with your appetite. It was even speculated that it may be involved in the process of developing obstructive sleep apnea, since it's a hormone that's involved in sleep, energy balance, and breathing. And since orexin levels tend to go down as you age, this may be one of many reasons why you may develop sleep apnea as you get older. In fact, a number of studies have documented lower orexin levels in people with sleep apnea. The next hormone, number 7, is insulin. It goes up significantly after you eat, since it has to shuttle the glucose that's been processed by the gut and is now floating around in the bloodstream. I won't get into the metabolic implications of how and why you gain weight. That's for another video as it relates to sleep. The important point here is that people with untreated sleep apnea have much higher levels of insulin resistance and diabetes. Hemoglobin A1C is also much higher, along with many other metabolic factors. The good news is that treating sleep apnea, whether through CPAP, a mandibular advancement device, or even with surgery, was shown to lower the levels of insulin resistance and A1C significantly. Poor sleep, whether through chronic insomnia or untreated sleep apnea, will raise your stress levels with higher levels of your stress hormone, cortisol, which raises your glucose levels. And insulin resistance tends to go along with obesity, high blood pressure, heart disease, dementia, heart attack, stroke, and cancer. And number 8 is the hormone leptin. This is the satiety hormone that fat cells make to say that I've had enough food, no more eating. When you eat, insulin goes up to supply energy to the body as glucose, and the fat cells respond with leptin. Interestingly, it's been known that people with sleep apnea have higher levels of leptin. And just like what happens to insulin, if there's too much in your bloodstream, your organs and tissues will become resistant to it. This applies to both insulin and leptin. And not surprisingly, leptin is a respiratory stimulant. Leptin receptors are found all over the body, including the brain, liver, heart, kidneys, testes, and ovaries. Leptin blocks neuropeptide Y, which normally suppresses breathing. In fact, the stimulating effect of leptin on breathing was found to be independent of weight, carbon dioxide levels, and food intake, which suggests that there's a direct connection to the respiratory system. And lastly, I mentioned that people with sleep apnea have much higher levels of leptin. With CPAP treatment, leptin comes down. This is probably related to leptin resistance, just like insulin resistance. But maybe with higher levels of leptin along with increased weight and worsening sleep apnea, leptin can act somehow to protect the airway by stimulating more vigorous breathing. Number 9 is corticotrophin releasing hormone, or CRH, and this goes up in response to any kind of stress. This hormone is made mainly in the hypothalamus in the brain, which goes to the pituitary gland to release ACTH, or adrenocorticotrophic hormone. ACTH then goes to the adrenal gland on top of the kidneys to make cortisol, your stress hormone. This works together with your sympathetic nervous system when you need to fight or run away. Corticotrophin releasing hormone also stimulates breathing centrally in the brain by raising your breathing rate and lung volume. You can see how this may be helpful if you have to run away from a chasing tiger. And lastly, at number 10 is vitamin D. I've mentioned in the past that vitamin D is actually a hormone since it travels through the blood vessels to work all over your body. Vitamin D can be found in various foods as well as being made in our skin through sun exposure. Because of the radical changes in our diet and eating habits, as well as experts' warnings to stay out of the sun, most people in the US are vitamin D deficient, even in the South. However, there are a number of studies that found that obstructive sleep apnea is strongly correlated with low vitamin D levels. There are a few small studies, such as this one, which found that for mild sleep apnea, supplementing with 50,000 units of vitamin D for 8 weeks raised the levels from 19 to 42, and the AHI on the sleep study dropped from 8.9 to 5.5, which is a 38% drop. Interestingly, I found this one study where CPAP in men raised vitamin D levels slightly, but it was still statistically significant. I hope you found this video helpful. There's so many different ways of looking at sleep apnea, but in this video, I focused only on 10 hormones that have direct or indirect effects on sleep apnea in either direction. The bottom line is that especially for women, progesterone is the most important hormone to be mindful of, especially in relation to monthly periods and around perimenopause. For both men and women, it's important to minimize exposure to toxic xenoestrogens, which can suppress our reproductive hormones. Thanks again for watching my video. If you have any questions or comments, please place them below. I'll try my best to respond as soon as possible. If you want to address your hormone imbalance that may be affecting your sleep as well, consider working with me on one of my virtual coaching sessions. For January only, I'm doubling the value of these sessions from 30 to 60 minutes. This special offer is only good if you schedule this month in January. Wishing all of you a healthy and happy new year.